Why is mandatory TB isolation ethically controversial? Imagine being told you must stay in a hospital or quarantine facility against your will simply because you have tuberculosis. This situation sparks a lot of debate because it touches on fundamental rights and public safety. The core issue is that mandatory isolation restricts a person's freedom of movement and bodily integrity, which are basic human rights. When health authorities isolate someone without their consent, it can feel coercive and paternalistic, making patients feel powerless over their own health decisions. Another concern is justice. Isolation policies might unfairly impact vulnerable or marginalized groups, such as the poor or those with limited access to health care. For example, incarcerating TB patients who refuse treatment can expose them to additional health risks and social stigma. This can deepen existing inequalities and raise questions about fairness and social justice. The ethical justification for isolation depends on whether it is truly necessary. It should only be used when less restrictive measures have failed and when there is a significant risk to others. For instance, if a patient with highly infectious TB refuses treatment and poses a danger to healthcare workers and other patients, isolation might be justified. But it must be proportionate to the risk, considering factors like how contagious the person is and whether they are adhering to treatment. Procedural safeguards are also essential. Patients should have clear legal protections, transparency about the reasons for isolation, and the right to appeal or review the decision. This helps prevent arbitrary or discriminatory actions and ensures that isolation is used fairly. Isolation can also cause social stigma and psychological harm. Patients may feel isolated, ashamed, or discriminated against, which can discourage them from seeking care or sticking to treatment plans. This can make controlling TB more difficult because untreated or hidden cases pose a bigger public health threat. Balancing public health and individual rights is tricky. While preventing TB transmission is vital, it should not come at the expense of personal dignity and freedom. Ethical policies should prioritize voluntary measures, environmental controls, and treatment adherence whenever possible. Mandatory isolation should only be a last resort when a patient clearly and persistently risks spreading TB and refuses all other options. In healthcare settings, these ethical issues are especially sensitive. Protecting patients and staff from TB transmission requires careful consideration of individual rights and public safety. Effective infection control includes environmental measures like proper ventilation and encouraging voluntary treatment. Only when a patient refuses all other interventions and continues to pose a serious risk should isolation be considered. And even then, it must be done with strict legal and ethical safeguards. Ultimately, mandatory TB isolation is controversial because it involves complex trade-offs. It aims to protect society but can infringe on personal freedoms. That's why it must be applied thoughtfully, with respect for individual rights, clear legal procedures, and a focus on the least restrictive, most humane options. Always remember, medical decisions should be personalized, and consulting healthcare professionals is key to ensuring ethical and effective care.